Adrenal calcifications in infants. Definition: adrenal calcification is not a rare finding in healthy asymptomatic people, and it is usually the result of previous hemorrhage or tuberculosis. Addison's disease patients only occasionally develop calcifications. Hemorrhage is the most common cause. Generally, patients with non-traumatic adrenal hemorrhage are critical ill and have a coagulopathy. Adrenal glands are proportionally larger in neonates than adults, and prone to complications from hypoxia or hypotension.
Hey guys, Dr. Berg here. In this video, I want to talk about the adrenal glands. Now, I have a lot of different videos on different aspects of the adrenal, but I don't think I have a video just on the basics of what the adrenal glands do. Now, there are two glands right on top of the kidney, right down here, and they are stress glands. So the body will respond to physical and mental stress with the help of the adrenal glands. So the adrenal glands basically adapt the different parts of your body to a stress so it can cope. For example, if you're being chased by a tiger, the adrenal gland will produce hormones to activate more blood flow to the muscle, increase heart rate, increase blood pressure, mental acuity, so you're all set to prepare yourself for flight, run away, or fight, okay? So the adrenal gland is very unique because it has an outside and an inside. The outside is all gland tissue. The inside is not gland tissue, it's nerve tissue. It's interesting. So you have this gland wrapped around a nerve bundle. And the nerve bundle makes neurotransmitters. And probably because of its location, it can have quick access to the heart and different organs because it's right in the center of the body. But it makes adrenaline, noradrenaline, which is a pre-adrenaline hormone. It also makes catecholamines, which are things like dopamine, serotonin, GABA. All the different neurotransmitters are made there. And it's part of the sympathetic nervous system, which again is the flight or fight mechanism. It's right inside the adrenal. Now the outside has primarily three categories of hormones, maybe four if you want to classify them a little differently. The first one is called glucocorticoids, which is basically cortisol. And by the way, all these hormones are steroids that are made from cholesterol. That's why you need a certain amount of cholesterol to make them, especially under stress. But the glucocorticoids, the name gives it away, glucose. Okay, they're hormones that do influence blood sugars. Okay, so that's why if you have too much of that hormone, you can end up becoming a diabetic. Because it produces, it turns basically things into sugar pretty quickly, your own muscle. So it makes quick energy. So if it has too much, it's going to trigger insulin, and you're going to get all sorts of issues. This is the one that I talk about producing belly fat, but really only through insulin, because it increases insulin. So insulin is the main hormone that does it, but it's cortisol that can trigger it. So cortisol affects stress, blood sugars, immune suppression. Now think about all the autoimmune diseases out there. Where your body attacks its own tissue. And then what's the treatment for all of them? Steroids. Prednisone. What's a steroid? An adrenal hormone. Cortisol. So your own body is supposed to produce hormones to counter that and suppress stress. In fact, if you look at the remedy, prednisone, and what conditions it treats, all sorts of skin problems, pain syndromes, inflammatory conditions, immune conditions, organ rejection type hormone. So everything with immune suppression. So it affects the immune system big time. If the adrenal glands are weakened, it makes you susceptible to viruses.
Applications in medicine. Adrenal calcification is best assessed in CT, where it can be differentially from calcified adrenal mass or lesion. CT also allows simultaneous characterization of any underlying lesions with side density and enhancement and washout. In children, neuroblastoma has been reported as the commonest calcifying adrenal mass. Thus, the survival of the child seems possible when the hemorrhage has not been severe. So children may not always show clinical evidence of the condition. In this symptomless case, the diagnosis will usually be made by chance when a radiograph, usually of the chest, which has been taken for other reasons, reveals the abnormality.
بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وآله وصحبه. As you see here, selected axial CT scan images of a patient with adrenal calcification on the right side, and this is a calcification also seen on the left side of the same patient. What is adrenal calcification? What are the differential diagnoses of adrenal calcification? Adrenal calcification, it is not a rare disease, and it is seen in symptomatic healthy patients, usually due to hemorrhage or TB. Addison disease also may have occasionally calcification. What are the causes? The causes of adrenal calcification is hemorrhage, infection, adrenal tumor, and others like Addison disease, Wolman's disease. Hemorrhage can be due to sepsis or can be due to trauma, adrenal cytocyst, neonatal asphyxia, coagulopathy, and infants calcification seen after hemorrhage in 1 or 2 weeks. Infection can be due to granulomatous disease like TB or histoplasmosis or others. Adrenal tumors like neuroblastoma, adrenal myelolipoma, adrenal adenoma, adrenal carcinoma, pheochromocytoma, and metastasis. Others, adrenal Addison disease, or might be that Addison disease it is primarily due to infection and Wolman's disease. And let us see some example of adrenal calcification. Before the examples, what are the radiological features of adrenal calcification? CT can be evaluated by CT, by ultrasound, and by brain film. The CT is the most common modality used for the adrenal calcification to characterize it and the size and also the location, and it is better than the brain film. In children, neuroblastoma is reported the most common calcification in the adrenal mass. Post-hemorrhage, like adrenal hematoma, as we said, it is developed in 1 and 2 weeks in infants after the adrenal hemorrhage and can be calcified. Some examples of adrenal calcification, you see this is the film of the upper abdomen with bilateral adrenal calcification.
Advantage. Adrenal hemorrhage is prognostically important because it may signify severe stress or unsuspected coagulopathy. The survival of the child seems possible when the hemorrhage has not been severe. Such children may not always show clinical evidence of the condition. In these symptomless cases, the diagnosis will usually be made by chance when a radiograph, usually of the chest, which has been taken for other reasons, reveals the abnormality. Disadvantage: post-hemorrhage calcification is usually seen after the initial adrenal hematoma has resolved and hence not usually seen with adrenal lesion. Adrenal glands are proportionally larger in neonates than adults and prone to complications from hypoxia or hypotension.
People often ask me, do children get adrenal fatigue? What I saw was, indeed, adrenal fatigue is present in children. It's present in almost all ages. And that it sometimes has a dramatic effect on their schoolwork, on their self-esteem, on their athletic performance, on their ability to concentrate, on their temper, on their ability to interact socially. Because remember that cortisol does so many things in a person's life, and the child is no exception. And so, for example, without cortisol, you can't concentrate as well. Well, that means that if a child can't concentrate, sometimes they're a little bit more of a behavior problem. If their blood sugar is not high enough and they're low blood sugar, they may become whiny, irritable, difficult to manage. And so as the cortisol increases, they become much more complacent and much more easy to manage. For example, I had a woman come to me and she had a child, and she brought him because he was having increased respiratory illnesses, and so I saw that his adrenals were weak. We started treating his adrenals. And she said after a while, she was in about 6 weeks or so, because with people with adrenal fatigue, I usually saw them every 3 weeks because the adrenals seem to work in a 3-week pattern. And she came in about the 6-week mark and she said, would what you're doing have anything to do with his school? And I said, what do you mean? She says, well, I got a letter from his teacher, a note from his teacher. And she said that he has always been a behavior problem. But since in about the last 2 weeks or so, he's not the behavior problem that he used to be. As a matter of fact, he's improved so much that she's moved him away from her desk. He used to have to sit right in front of her desk. And now he's back in the third row. And he's not reaching over and pinching kids, and he's not being inappropriate. Seems to be more centered, more focused than he used to be. And his math scores have really changed dramatically. That it used to be that he was having difficulty with math, and now I've even on 2 occasions seen him helping students with their math. He's changed just to such a degree. I wanted to know if you're doing anything that I should be aware of. And I said, yeah, of course, that makes sense, because the adrenals do help with concentration. Without adequate cortisol, you can't form an alpha wave. Without an alpha wave, it's more difficult to concentrate and relax and focus and do the higher math. And so it makes sense that he would be that. And with more cortisol going to the brain and blood sugar being more normal inside the brain, then a lot of times behaviors do become more normalized because they're not acting out, trying to overstimulate themselves in order to be adequately stimulated. There are a couple of studies on young teenagers, mainly young men, who have had chronic marijuana use between the ages of 12 and 14 or so. And there's a disproportionate number of them that seem to end up in extreme sports. And when they've gone further and tried to investigate, these young men normally have low cortisol, and the extreme sports help them feel normal, because that's when they get the overstimulation, but that's when they feel normal, because they need that overstimulation because the adrenals are a little bit underfunctioning. And so adrenal fatigue in children happens at all ages, from the very small on up through the teenage years. And I've just seen tremendous results when you use natural substances that help the children recover from the adrenal fatigue. So how would you know if a child has adrenal fatigue? One of the things is they're sluggish in the morning, and you might say, well, what child isn't? That's not true. A lot of children wake up bright and bushy-tailed at 5, 6 in the morning, ready to go. But if they're sluggish in the morning, they have a picky appetite, picky eater, they have an afternoon lull, they have difficulty sleeping at night, you put them to bed, they don't go to sleep for a long.
Issue applied in Ecuador. So we have this table that it is the percentage distribution of tumors by internal calcification in Ecuador. And here we can see the numbers of the cases. Adenocarcinoma are 21 cases, and lesions calcification 30, with internal calcification. Percentage represented the 14.28%.
Hi, this is Elliot Fishman, and welcome to part 3 of 3 on the adrenal gland, the pattern approach. Last time we spoke about primary adrenal carcinomas and some of their appearances. Now let's speak about metastasis. Metastasis are probably the most common adrenal mass we are going to see that's malignant. Variable size and appearance with attenuation values that are variable. Most common primaries would be lung, breast, renal, and melanoma. When you ask the question, can I look at a MET and determine the primary? Rarely I can. Vascular, I think of renal cell. Bilateral enlarged, I think of melanoma. You can see the same tumors can have multiple appearances. This is a primary lung cancer. The lesion is very cystic, and on the contralateral side, it's more solid. We can look at this example of non-small cell lung cancer. Again, solid appearance, or depending on when you scan the patient, it could look more necrotic. So even the appearance in the same patient will vary whether you're at 30 seconds, 60 seconds, or 5 minutes. So it's really very variable. Metastasis can have some vascularity. They all have some vascularity. But as I mentioned, renal cell is where you have marked hypervascularity. You can see just the appearance. In a patient, we talked before about incidentalomas. This doesn't look like an incidentaloma, but with a patient with lung cancer, this will be metastasis till proven otherwise. Mets can be very cystic. Look at this large lesion in this case. When I think cystic, I think about things like melanoma, but it doesn't have to be melanoma. Here's a case with melanoma, the most common bilateral I think of. Melanoma, you can see adenopathy present. And I mentioned when lesions are vascular, you've got to think about renal, especially when the patient is missing their left kidney. You see nodes by the surgical bed. But here's another one with vascular mets to the patient's right adrenal. Remember, with renal cell carcinoma follow-up, we always do arterial phase imaging. Sometimes the mets are only seen arterial. That's particularly true in the pancreas. But you can see in this case, adrenal lesions are vascular, and the patient's adenopathy by the surgical bed is vascular. And here that is again on the coronal display. So very nicely showing you both the adrenal lesion as well as showing you the extensive adenopathy. Very nicely defined. And here's a really impressive case. Look at that 5 millimeter left adrenal metastasis. There it is axial, and there it is coronal. So you can sometimes see very small metastasis. Now here's a patient.
Conclusion. It is well known that the adrenal glands of the newborn infant is relatively large compared to that of the adult, and is especially so when the child is premature. The gland undergoes a rapid evolution after birth, but before this size and immaturity must render it more liable to damage. This may occur in relation to an abnormal presentation, and the breech variety seems particularly vulnerable. Then again, when there has been fetal distress, the too vigorous application of certain types of resuscitation might easily inflict damage. Finally, the presence of some hemorrhagic disease of the newborn or of asphyxia neonatorum are further antiological possibilities because of the alteration in the vascularity of the gland which they might produce.
The adrenal glands are small glands located on top of each kidney. They produce hormones that you can't live without, including sex hormones and cortisol. Cortisol helps you respond to stress and has many other important functions. With adrenal gland disorders, your glands make too much or not enough hormones. In Cushing's syndrome, there's too much cortisol, while with Addison's disease, there is too little. Some people are born unable to make enough cortisol. Causes of adrenal gland disorders include genetic mutations, tumors including pheochromocytomas, infections, a problem in another gland, such as the pituitary, which helps to regulate the adrenal gland, and certain medicines. Treatment depends on which problem you have. Surgery or medicines can treat many adrenal gland disorders.